Hey Darius, I wanted to ask you about this concern that
Yeah.
some dentists have. And I actually, to be honest with you, it was a concern of mine as well. Everybody's asking for more money. And when you explained it to me, I totally did a 180. I realized that it's a phenomenon that's happening anyways. So I want to ask you what your take is on it.
Well, there's a few opinions I have around that. Let me first start with the backgrounds of who we are versus the competition or the alternatives, I'll call them, in the context of this conversation. Our setup at Cloud Dentistry is the only pure marketplace, meaning we give both sides the decision of how they want to classify the professional. Our alternatives dictate how they have to classify it. In many cases, I can point out, if you'd like, our competitors misclassified your temps as 1099s, and they got hit with a $500,000 lawsuit from the AG. That's one differentiator. Two, we don't have any middleman fee. So all boats rise. I guess that's one colloquial way I could phrase it. But this is just an extra way that the office can connect with more professionals in a transparent and quick manner at a fraction of the cost. If you're using Indeed, keep using Indeed. If you feel as if it's worth what you're paying, because it's probably 10 times what you're paying as a subscription for cloud dentistry, keep using it. These are just extra layers of tools to connect with the working industry. The middleman fee of the hygienist is something that, because it's not there, and because of the supply and demand of what's going on, I mean, about 30-40% of the hygienists from COVID start to the end of COVID just stopped working. So supply and demand has a law of economics behind it. As supply constraints, demand goes up. Our demand in terms of the subscription fees stayed the same. We never raised our fees, in fact, since day one. And our model has always been a SaaS model. We never changed it. We chose to work it this way so we don't charge you by utilization, meaning the more you use it, the more you have to pay, like with Indeed. You don't have to pay a middleman fee. You can negotiate whatever rate you want with the professional. If it's displayed on their profile, that just means that you're obligated to pay that if you book them on the app. You could still message them and say, hey, can I get your cell phone number? I want to talk to you about a full package. And it's likely they'll think otherwise if you catch the right person. That's a big thing that people don't really understand, is that cloud industry is just another way to connect with the workforce. The displayed numbers of the professionals are all done by them. We don't have any interference in that. In fact, at the most, we just tell them what the averages are in the area in terms of hourly rate, what the minimum shift books are, and we just transparently display all that data for them so the professional can make a decision of how they want to make best of use of their own time. That's really what it boils down to. Really, what you're dealing with is a massive pool of DAs and professionals that, for the most part, they already have permanent work jobs. They may not tell you that. They may not, they probably will lie to you actually and say, I prefer to temp. But in actuality, what they're doing is hopping around on their open Fridays, interviewing one office at another, seeing if there's a better deal around. Because again, supply and demand, there's fewer supply and way more demand than before. So naturally, the rates of the hygienist from a macroeconomical perspective rises. Do we wish we can control it? Sure. But the moment we start controlling it is the moment that we have to start classifying their wages, because that's by definition what it is. We are a free marketplace for them. These staffing agencies and recruiters, they're not a free marketplace economy. They dictate how they have to be classified. They even dictate how much they have to get paid by hour, because they say, you know what, I'll take the difference. I'll pay you 35 and I'll charge you, Mr. Office Owner, 65 an hour. That's how they make their spread. And if you want to work with them directly, they're going to charge you thousands of dollars as a buyout fee. Content industry has none of that. For an average subscription of less than $100 a month, you have a golden tool to be able to get in touch with as many working professionals as you want. It's up to you what offer you want to give them as a full package, of course.
Yeah, so basically to summarize, cloud dentistry, you pay a monthly subscription fee. It's a flat set fee.
Yes, for
And
unlimited bookings and unlimited messaging.
exactly. So that gives you access to your platform that the other side is posting their profiles. You guys don't decide on anything. You basically have some tools to help us to say, hey, if you're going to hire someone, this is the going rate, right? And the important thing for people to understand is that you guys don't make any more money if somebody books, or if somebody doesn't book, you don't make less money. You have a flat fee. And that's why I like your platform for myself, right?
And the empowerment goes both ways, I have to say, because as far as the empowerment that we create for the professionals, the hygienists, the DAs, that's all around not putting the golden handcuffs on them and buyout fees and not charging a middleman fee. And we also offer Cs to them, which is available free of charge for the offices as well, right? So there is really no difference in the essence of how we're empowering their side versus the office's side, which is giving them this tool at a time that 65% of the country says they need it the most, to not get fleeced with some crazy middleman fee or buyout, and just try a bunch of people to see who you like. Essentially, that's what the essence of this platform is built to help, is to give both sides options at the end of the day.
Right. Can you address Colorado? Because you mentioned to me Colorado is a strange state right now regarding these fees. Is this an anomaly? Because we see it in my area that prices are stabilizing. What's going on in Colorado?
So there's a chart. I don't know if I ever showed it to you. It was a skill set chart by state. Have I ever showed this to you before, Bob?
No.
If I may share my screen, I'd love to show the group because it may provide some context as to what's going on in Colorado and also nationwide as well. As you may know, different states vary with the supply of available hygienists in the market. At the same time, different states vary based on the skill sets that a hygienist is allowed to provide. This is a little wheel I've been working on. So let's go to Colorado right here on the lower left. In Colorado, a hygienist is allowed to do all the above. So what's happened? In Colorado, their average hygienist is making about in the mid 60s, low 70s per hour. And that's with no middleman fee, no staff, no staffing agency in between, over a sample set of thousands of bookings. We have a majority market share in Colorado right now of offices using us amongst the hygienists and DA pool. I think one of the reasons why it's become popular for hygienists to earn so much and for offices to want to embrace that is because of all the skill sets that the hygienist is able to do for the patient and for the office.
And what are these? Let's read these. Dental hygiene diagnosis. So in most states, you cannot do that. I see it's happening in Oregon, and that's it.
And Colorado.
Yeah, exactly. Colorado and Oregon.
Right.
Prescriptive authority.
Yeah. They can even Medicaid. They can write prescriptions in Colorado.
Wow. Interesting. Yeah. And a few other ones can do that. Local anesthetic. Obviously, most states have it. Supervision of dental assistants. Wow. Direct
Bob, correct me if I'm wrong. I got to ask this question though. Please let's be honest.
Okay.
Does the hygienist in Colorado have the ability to help a burnt out dentist more than the hygienist in, let's say, North Carolina that is not allowed to do any of these skill sets?
I mean, it's a good point you bring on. But my point here is, Dariush, is that we can't be all about small business and capitalism and let's survive our small businesses and then try to control someone else's salaries, right?
Exactly.
The marketplace is going to dictate. Don't hire at $75 an hour and see those prices go down. But this chart is really eye-opening. I would like for you to, if you don't mind, send it to me.
Not at all. Sure.
So I can post it in the group. And, it's good to see. But yeah, there were some people from Colorado that they basically voiced their complaints. And how's New York? New York doesn't allow them to do anything. New Jersey doesn't allow them to do anything. Just
Correct.
Local anesthetic, basically.
Yeah, that's right. I mean, you also have the concept of, in any given city, it's a marketplace of its own, and you have a certain degree of concentration of professionals versus offices. So sometimes that leads to an easier time finding people or more transiency. Depends. In New York City, Cloud Dentistry has about, in one zip code in the city, hundreds upon hundreds, if not over 1,000 professionals ready to work. You can't tell me that all those professionals are not available for the hourly rate that you think you could work out for them. The free market economy marketplace always wins. You could always message them and do a Zoom interview or invite them over to the office and have a conversation about the rates. I mean, if I was in the office situation, I would have that conversation after I hire them, because if it's the right person, if it's the ideal person, I'll call it, I don't think you're going to care as much. But that's for discussion maybe after you hire him for the day,
Right.
Again, it's just another way of connecting with the industry. You don't even have to book them. You could just message them and say, do you mind if I have a FaceTime interview with you?
About the fact that there are people who are blaming Cloud Dentistry for current market conditions. Show me this. This is a Health Policy Institute of the American Dental Association, right?
Correct. Right. Well, the HPI Health Policy Institute runs these chief economic reports where they survey thousands of dental practices a year to find out what's actually going on. I'll send you this link so you can post it on the group and they could read this for their own edification. Now, basically, there's a lot of staffing elements around this that I wanted to talk about. Here's one, for example. Which of the following factors prevented your dental practice's appointment schedule from reaching 100% last week? 20% said they were out sick, COVID, other illness. 6.9% said staff shortages, reduced hours. 6.9% said staff on vacation, on leave. In all, that's about 32%. A third of the time, they're not able to see all the patients because of staffing issues. Now, let's go into what's going on around the country from each professional type they're trying to hire. A third of the country is trying to look for a hygienist right now. 36% is looking for a dental assistant, 14% is looking for a DA, and 21% is looking for a office manager. This is an all-inclusive number, meaning it could overlap where one office is looking for two types of professional types. How challenging has it been? 81% say it's extremely challenging. yeah, it's easy to sort of look at cloud dentistry and say their success has caused this problem, but it's not. That's a misnomer in reality. The entire country is having difficult time. They call it extremely challenging time out of a category rating scale of very challenging, moderately challenging, slightly challenging, not challenging at all, not sure, not applicable. They chose the higher echelon of the supermajority of the time. They're trying to also indicate what staffing positions they're looking to hire in 2023. And this was based on 850 responses. All the data around the staffing is here. Cloud dentistry is purely just bringing more liquidity into the market with no friction between the office owner and the worker getting together. And if you ask any economics professor what that means, it means that all boats will rise and the rates of it will come to equilibrium of what the hygienist is going to end up getting paid. Because if you don't pay the hygienist their wage and you find them through a recruiter or staffing agency, you're going to end up paying the difference of the fee to the staffing agency or the recruiter. You may not even realize it. The other part of this report was asking these offices, how much did you spend in HR recruitment over the past year? The average response was 10 grand. 10 grand on middleman fees, 10 grand on buyout fees, 10 grand on Indeed job posting credits
Yeah.
a year.
Buyout means if you hire that temp, you have to pay that to the temping agency.
Exactly.
Yeah.
All in all, the average blend came out to $10,000 per office location. So should you be worried about the display of a hygienist showing that she's $5-10 an hour higher, especially given the fact that you could reach out to them and negotiate something? It's silly. It's maybe a misunderstanding of how the essence of the app really can benefit a practice owner.